Hi, I'm Meshal Malik and you're watching Indus Special. The city has turned into a gas chamber. These were the words of New Delhi's chief minister after India's capital experienced lethal air quality levels late last month. The city was forced to take emergency steps in order to protect citizens from the hazardous air, and the problem continues to persist. However, what's happening in India is a part of a larger problem, a problem that confronts many parts of Southeast Asia, including Pakistan. As air pollution worsens and winter approaches, millions of people are finding it difficult to breathe without consequence. On today's show, we take a closer look at what many people are calling the fifth season, the smog season, as it approaches. What is causing it and how detrimental it exactly is? Joining us for this discussion today, Ahmad Rafay, an environmentalist joining us from Lahore. Also joining us is Hridesh Joshi, a journalist and an environmentalist joining us from Delhi. Thank you both for joining us and welcome to the show. Mr. Joshi, I'd like to begin with you. Now, you talking to us from Delhi, give us a sense of what is happening on ground after the emergency that was declared, after the air quality had deteriorated to such a bad state.
You see, I mean, Delhi is actually, we are facing very bad air quality here. Air quality is, much high. Air quality index is much poorer than what we say the severe plus for last, we can say for a week. But on Sunday, it was terribly bad. Sunday was really bad, and people were complaining of, the irritating eyes, and they were obviously they were having a lot of problems in breathing and all that. So fortunately, there was some wind blowing, and Monday looked a little better, but satisfactory. So there are 2-3 things we have to understand. First thing is Delhi is landlocked. It is actually prone to air pollution. Second thing is that it is highly polluted because of, there is a lot of population there. The surrounding areas of Delhi has a lot of power plants who are actually not, equipped or complying the standard rules, which, they should be doing. Court has ordered in 2015 for them to equip some equipment to prevent the pollution. Like SO2, prevention of SO2 coming in the air, emission of SO2, like that. And other thing is that, which generally you may be hearing that in surrounding areas, the stubble burning by farmers because they are preparing their fields for new crops. So that is also, contributing to this. So that all is contributing, but some steps have been taken, like, the odd even car rationing scheme that has been implemented. But alone that cannot do. There are a lot of steps have to be taken together, and only then the air quality of Delhi, which is the capital of India, will improve.
Mr. Joshi, as you mentioned the crop burning here, now smog and the air quality worsening this time around is of course an issue that was also experienced the previous year and the year before that. Now, it consistently proves to be a problem each and every year. Was the government more strict on crop burning this time around?
Yeah, crop burning is around, but we cannot say that government did not do anything at all. But the scale of action, the penalty and the stringency of the actions has to be manifold high. For example, in now Delhi, we have a peripheral road which takes all the polluting trucks, heavy trucks out of the city. They don't enter in the city, and if they enter in the city, they have to pay environmental cess. In Delhi, within Delhi I'm talking, there is no coal power plant, thermal power plant now. They are on a less polluting fuel, what we say is like a natural gas. So steps have been taken. All commercial vehicles, light commercial vehicles and public transport is running at low polluting fuel. But, you can understand where 2 crore people are living there. So what we say is that 20 million people, they are living there. So, and there are small industries also. And as I told you, surrounding areas are, polluting power plants. So all these things make the things terrible. And the steps have to be taken at a much higher stringent level. And only one step like doing odd even, which is a good step, I believe, that will not do. They will have to work on a large scale and consistent.
Right. Mr. Alam, as I mentioned as well, what we're seeing right now, the air quality being so terrible is, of course, not just isolated to India. Pakistan, the neighboring country, is also experiencing it. Give us a sense of how widespread this issue is, especially in this region.
Air quality isn't a Delhi or a Lahore issue alone. A lot of people conflate it and mistake that it's just these two cities that are impacted by poor air quality. The reality is the entirety of the North Indian, from Peshawar to Dhaka, including Nepal, is subject to unacceptably dangerous levels of air pollution. Yes, there are air pollution problems in Lahore, and there have been some studies to give source apportionment as to where these elements of pollution come from. And what we've been able to put together here from official reports over the years is that nearly 80% of the air pollution in Punjab through the year is caused by the energy, transport, and industrial sector, and that the remaining pollutants come from things such as municipal waste burning, crop burning, construction dust, and automobile dust. And as my friend from India was saying, responding to each of these is the need of the hour. And the problem is that a lot of these answers or policy initiatives are split between the province and federation in the case of Pakistan and the states and the center in the case of India. And there's a lot of lack of communication between the states and the center when it comes to the coordinated implementation of a clean air program.
Right. Mr. Alam, now, of course, how bad the air quality is, it becomes most manifest during this time around. But throughout the year, do these regions also suffer from and experience poor air quality throughout the year?
Make no mistake, it's in the winter times that because of the cool air and the haze, we can see the air pollution. But make no mistake, the North Indian Peninsula, the North Indian continent, is subject to unacceptably dangerous levels of air pollution throughout the year. It's only this smog season that you call it, between October and December, that the situation is so bad that it's visible. And in some cases, actual smog situations take place over parts of developed areas in the region.
Mr. Joshi, now I have you from Delhi and Mr. Alam from Lahore, and I want to put this question to both of you. But I want to start off from asking you, this issue that we see of air pollution, it's a cross-border issue. It doesn't know any boundaries. And of course, seeing the politics of both nations unfold, with conflicts aside, with politics aside, what policies do you think need to be put in place in order to tackle this in a more systematic manner?
What I would say that India and Pakistan, this is one issue where they should come together and they should fight this. Why fight this problem together with full force? Why I'm saying this? Because if you see Lancet report, which came 2 years back, if you see the SOGA report, which came last year, and if you see Indian Medical Council Research Institute, all these reports are saying that in South Asia, India, Pakistan, China, all these countries, maximum number of casualties are happening due to air pollution. Our future resources, future human resource, our children, they are dying, they are being crippled because of this pollution. So we can make a lot of missiles, we can make a lot of progress in software engineering and all that. But it is not going to help us until we have clean air, clean water, because it is not limited up to clean air only. It is also, our water is also contaminated. Our food is also adulterated. So first we should together, because geographically we are at a contiguous, land. So India, Pakistan, Bangladesh, all these countries should come together. They should try and make a roadmap to fight pollution. They should exchange ideas and knowledge. And they should make a roadmap to fight not only pollution, but also climate change, I would say.
Right. Mr. Alam, as Ms. Joshi said, that this roadmap needs to be created and needs to be created urgently. Do you see that happening, given the situations and the current political dilemmas that we are in?
Well, I absolutely agree that air pollution, if not tackled at a regional scale, can't be tackled at all. And I want to address the politicians on my side of the border who last week spent time pointing fingers at India blaming the pollution and air quality in Lahore and in parts of our Punjab on Indian crop burning, when it is well known that this time of year is dominated by westerly winds that take air towards India. In these circumstances, where federal ministers and advisors are pointing and denouncing blame, is criminally, I feel, negligent and ignores the fact that tens of millions of people, their lives and their futures are at risk. There is far more green policy area development in cooperation between India and Pakistan on subjects such as air quality than there can ever be cooperation on these toxic issues of Kashmir and terrorism. And I only wish our politicians would see the benefit that would accrue to the tens of millions of people if they stopped pointing fingers at each other and sat down and tried to tackle this problem.
Right. Mr. Joshi, just a last question to you before I do off. Now, how are the citizens trying to fight back against what has unfolded in recent days, in the recent week, in terms of air pollution? What are the civilians doing on ground right now?
I want to add one thing that which will be answer to your question also, that only saying that farmers are polluting, their stubble burning is polluting, that's also an easy target to say that farmers are polluting. If you see that India's Supreme Court appointed monitoring committee has told to court to instruct the state pollution control boards to also control the industrial garbage burning. Very poor garbage control system, garbage management system is around in our cities, all over, South Asia. So, if you are burning garbage all the year, you can't blame farmers for burning their crop. I mean, of course, that should also not happen for just 1 week like. So, I think those things will be addressed, and only then, as I said, only then we can fight this problem.
Right. On that point, thank you so much, Mr. Hridesh Joshi, for joining us from Delhi. I'd also like to introduce another guest who's just joined us, Dr. Edmond Fernandes, who's a community health physician and global health expert, joining us from Mangalore, India. Thank you so much, Dr. Fernandes, for joining us. Now, as we've been talking about how deadly the air quality has been, not just in India, but throughout the region, and not just in this season specifically, but throughout the year, give us a sense of how detrimental this is to the health.
So there are different ways to look at it. I mean, while there's a lot of conversation that goes around saying that, yes, it causes respiratory illnesses, it has the potential to cause cardiac diseases. There's also evidence to prove that it has at-risk tendencies for Alzheimer's and Parkinson's as well. But while we would all like to talk about clean air as a human right, what we also need to understand is clean air as a human duty. What is our duty as children of this universe first? We are unwilling to compromise on our comforts and also in terms of festivals. So even if you look at, let alone Delhi, look at Beijing in China, look at Karachi, or look at even other cities around the world, it's the human duty which we first need to focus on, and then comes human right as a whole.
Right. But on that, give us a sense of when humans do fail to respond adequately to what their duty is, to actually take in control to what they should be doing. How does that harm them at a fundamental level? Now, a lot of people are seeing literature come out, especially in recent days, about how this air is hazardous. There is talk of the air quality index. There's talk about the particulate matter in the air, but there isn't a basic understanding of how fundamentally it impacts your health. Give us a sense of that.
So it's very simple. I mean, whenever you have all these particulate pollutants going into the lungs, it simply just gets logged there. And over a period of time, people repeatedly breathing that same kind of carbon monoxide and other particulate pollutants would have their lungs blackened. And the effects of it is not going to emerge tomorrow or day after. It's going to be a long-term effect. That's why you don't have people in general feeling that as an emergency. but then scientific community coming together to talk about emergencies per se. Yes, the issues of respiratory illnesses would come up. You would have asthma, you would have chronic lung diseases. It could lead to bronchitis and aggravated COPD patients. It could also lead to cardiac ailments, those suffering from comorbid conditions and those who are already having weaker immunity, they are going to be affected by it.
Right. Mr. Now, this is a question also that you hear people talk a lot about, questioning whether the smog or what we see right now is worse than the year before. Are there any trends? Is there data that gives us a sense of whether it's getting worse year by year or where we are headed right now?
Actually, in Pakistan, there's a surprising lack of research conducted connecting the impacts of poor air quality on health. There was a study commissioned by Air Quality Asia and carried out by the Children's Hospital here in Lahore, which is the largest children's hospital in the world. And they reported that the admissions of children reporting respiratory ailments in the last 10 years has nearly tripled. And the evidence that they have from 2018 clearly shows that hospital admissions presenting cases of asthma or of pneumonia shoot up during the winter months, consonant with the smog emergency. So air quality does impact everybody. There's no such thing as a safe amount of air quality. However, that said, children and senior citizens and pregnant women are more at risk than others. Children especially, because they breathe more air per pound of body weight than adults, because they're developing. Doctors have found that almost all organs in a child's body are susceptible to poor air pollution, including the development of their brain, and it could also lead to things like stunting. So the medical impacts of air quality are literally terrifying.
Right. Now, with all of this, what can an individual do in the meantime to protect themselves?
Well, there are several measures an individual can take to protect themselves. First, you have to be aware of how bad the air pollution is so you can take corresponding levels of precaution. If air pollutions are moderately high, then things such as a glass of water or a pair of glasses might work. But when the AQI or particulate matter goes into hazardous or dangerous levels, then you have to invest in a mask. And I would also suggest that homes and offices and public places also start kitting out with air purifiers so that people don't have to breathe impure air at the workplace or at schools. Now, that said, there is precious little individuals can do to improve the ambient air quality. Because as I said, in Pakistan, nearly 80% of the pollution around the year comes from things like the transport sector and the energy sector and the industrial sector. So much more than individual actions, it has to be collective political action to address these sectors and to bring reform and sustainability and better air pollution practices.
Right. Dr. Fernandes, now the World Health Organization has also put out figures in which it states that air pollution is causing 7 million deaths a year, and this will, of course, significantly go upwards. Is this a trend that you have also been witnessing in terms of respiratory diseases, cases coming into hospitals, in which you do see a trend in which more and more people are getting impacted by the air around us?
Absolutely. I think this tendency is more in metro cities, and you would not find it much in Tier 2 or Tier 3 cities. But if you look at the levels of air pollution, my office just did some background research, and we have China, India, Pakistan, Indonesia, and Bangladesh topping the list. I think there's a sincere and serious requirement of SAARC nations coming in and Asia as a whole, which really needs to put together a commitment to battle air pollution. It's a silent epidemic. You would not see it in terms of how you measure disasters or how you would measure road traffic injuries. Because if, for example, a patient is suffering from a lung disease, he or she would go to their doctor, the doctor would treat it, the patient comes back. So you don't have a snowballing effect which is seen in terms of air pollution affecting a community as a whole. I mean, why is there much conversation revolving around New Delhi right now is because of visibility being so poor that it's evident that there's pollution in the air in terms of smog. But otherwise, you also have other cities around the world where the burden is equivalent. So the whole agenda here is to put more effort and investment into research to understand what policy decisions can be favorable in terms of public spaces, and to also collectively battle pollution as a human duty and not just a human right.
Right. Mr. Alam, you also mentioned how there is a shocking lack of research in how air quality is impacting the health of people in this region, in Pakistan specifically. Now, I want to understand, where do you feel research and development needs to significantly improve for us to tackle the epidemic we're facing right now?
2017, the Lahore High Court was hearing a public interest case regarding air pollution, and I remember distinctly that the Secretary Health came and gave a statement that the patients admitted into government hospitals in the smog season of 2017 were no more or less than the patients admitted in 2016. That's the only data they had. And what I took back from that is that the bureaucrats in charge of the sort of health facilities in Punjab hadn't the research to be able to take to the stakeholders and policymakers for decision making. We need much better understanding of what patients are presenting to medical experts when they come to hospitals. We should be asking them where they work, where they live, and taking details of what aspects of sort of health impacts are being felt upon them by air quality. And it's by collecting that information that we'll have a much more nuanced and sophisticated understanding of how people are affected by air quality. Hopefully, and we're working with some civil society organizations with a research hospital, a medical hospital here in Lahore, and we hope to inaugurate Pakistan's first research center on air quality and health later this year.
That would be a great initiative and a great step moving forward. Mr. Alam, I just want to put a last question to you, and it's something that Dr. Fernandes mentioned earlier, which was compromising on our comforts. At this point in time, how important is it for us to compromise on our comforts in order to make sense of what is happening and also to move forward?
You see, we haven't just gotten here overnight. The ecosystem and the airshed in the North Indian sort of continent has reached carrying capacity. We just didn't get here overnight. We are here because of decisions and development trajectories over the last 2 or 3 decades. And it will take that much time to unmantle them and dismantle them and slowly move towards sustainability. I think what we need, especially in Pakistan, is better research. We need certainly more information about air quality, and we need our policymakers and stakeholders to believe the data rather than deny it, to accept the fact that something wrong is happening over here, and then to begin addressing it one thing at a time. What seems insurmountable at first glance, if broken into smaller parts, surely can be overcome.
Right. On that point, thank you so much, Ahmad Rafay Alam, for joining us from Lahore. We're going to go for a short break. When we return, we take a closer look at how countries need to make healthcare more accessible with the changing environment. Stay with us. Welcome back to the show. Now, the World Health Organization has stated that there is an urgent need to double health coverage between now and 2030, or up to 5 billion people will be unable to access healthcare. Now, as the environment changes, reports indicate that health costs are rising considerably. On today's show, we discuss what at national and international levels needs to be done to cope with the rising health costs, and how can the most vulnerable populations be protected. Joining us for this discussion today is Vicky Pryce, an economist and former joint head of the United Kingdom's Government Economic Service. She joins us from London. Also joining us is Dr. Edmond Fernandes, community health physician and global health expert, joining us from Bangalore, India. Thank you both for joining us. Dr. Fernandes, now let me start off with you. Tell us, now with the state of how the environment is changing, and we talked about this in our segment earlier, how air pollution is causing more and more people to become sick each and every year. Do you think health facilities are improving at the same pace, and especially when we're talking about developing nations?
I think for health facilities to improve, we first need to bring healthcare discussions related to environmental challenges right into the medical curriculum, where we train the undergraduate students of medicine and then we train the master students. So right now, if you look at the current syllabus, not just in India, but across Asia and around the world, conversations around environmental pollution for medical doctors is very limited, if not sidelined. And even these discussions related to environment do not really feature into examination questions. So there's an inner tendency of doctors and physicians in training to sideline or push environmental discussion, climate change and climate action effects on human health to an alternate form of reading, which you would probably classify under the nice to know kind of category.
So you would say way behind.
I wouldn't say we are way behind, but our priorities are conflicting. On one hand, you have infectious diseases. On another hand, you have, with increased urbanization, people are developing lifestyle-related diseases. And on the other hand, the Indian subcontinent or Asia per se is prone to disasters, where you have another sizable amount of your economy being spent in disasters. So where does air pollution fit into this picture, or even environmental needs? It's conflicting priorities for which we need a systems approach which brings in inclusion into medical dialogues, right, not just in and around hospitals, but across public health institutions around the world.
Right. Ms. Pryce, now, the United Nations set the goal of trying to achieve universal healthcare by 2030, the partners of the United Nations. Now, from an economist's point of view, do you think that this is likely to happen, that this is possible?
Well, the first thing to say is that there are still quite a lot of countries that don't have universal health care, and there are quite a lot of people, I mean, there are hundreds of millions still, who don't have access to at least one of the essential services they need, whether it's family planning or vaccinations. And of course, with climate change, this is going to become increasingly important, particularly as diseases are likely to increase, as there are likely to be all sorts of problems in terms of the type of feedstock that exists. People's food supplies will be affected, and not just those on land, but also when we look at the resources in our seas. And that's going to require quite a lot of attention in terms of the way that people grow, develop children in the future. The problem is that what you need is more universal health provision, which is going to be very costly for many countries in the developing world, but also in the developed world. And that has not really been taken into account at present. And for me, it would require a huge transfer of funds or some different way in which that healthcare is provided. Maybe what we just heard about being more aware of what is needed would help, but I'm afraid it's going to need an awful lot more cash as well.
Right. So, Ms. Pryce, of course, an economist always does a cost-benefit analysis, so does a business, and so do governments. Now, in this case, you also mentioned the impacts of not having accessible and equitable healthcare for individuals and citizens. And then you also talked about how it's going to be a very expensive thing to do, trying to implement universal healthcare. Now, in all of this, do you feel like the cost would outweigh the benefits?
No, not at all. I think we absolutely need to do it. But of course, remember, there are going to be loads of people, it's already happening, misplaced or displaced. And they will move away from their traditional grounds where they were perhaps growing food or doing their business. And that will also need to be accommodated somehow. So that's an extra cost. But if you look at even the cost of having universal healthcare with a sort of single entity sort of dispensing that healthcare in the US, which is what, for example, one of the Democratic candidates, Elizabeth Warren, is suggesting right now. And the estimates of costs are huge in terms of the sort of trillions of dollars that's going to cost. And even in a country like that, the cost-benefit analysis is a tricky one to do. But I think if we are to preserve the sort of human nature, if we are to preserve ourselves for the future, then having a lot more attention on the health needs of a population all across the world, which is going to be much more affected by climate change than perhaps people had been anticipating just a few decades ago, is going to have to be a priority. So perhaps a lot of resources will need to move to that from elsewhere. But of course, if you do that, then you suffer in other ways in terms of development. So a decision needs to be made somehow in terms of how that funding will be done.
Right. Those are all very essential points. Bring a number of questions to mind. But before that, I want to jump back to Dr. Fernandes and talk to him about how, when we're seeing all these numbers, we're talking about all these costs. But as you also mentioned, it is certain parts of the world that will be facing climate crises at an accelerated pace. And we're also seeing it happen right now, India being one of them. Now, in all of this, do you feel like the regional government, the local government is making healthcare a priority?
Absolutely. I think with the Indian Prime Minister championing Ayushman Bharat, healthcare has been a priority for the Indian government like never before. And I would also like to add to what Vicky Pryce was trying to say in terms of cost-benefit analysis. We have been championing the model of the doorstep doctor. And the bottom line of argument is that in today's day and age, if you have Amazon reaching your doorsteps, if you have pizza delivery guys reaching your doorstep, then why not take healthcare to the doorstep? So this cuts the cost of patients incurring indirect cost of coming to the health systems. You're taking a health team to the doorstep of communities and patient care. Secondly, you put in environmental experts and public health specialists who can teach and train communities on better sources of consumption in terms of fuel, where you move into solar energy, you bring in more sustainable ways of using fuel, which would eventually have a very strong impact on not just communities or local governments, but which would magnify across the world.
Right.
And it's about investing right and investing sufficiently, which will change the ball game of healthcare, not just in India, but anywhere in the world.
Right. On that point, thank you so much, Dr. Fernandes, for joining us and talking to us. Ms. Vicky Pryce, going back to you and talking about something that you mentioned, that healthcare is not being seen as a priority. Now, the World Health Organization's COP24 special report stated that health and climate change stated that only approximately 0.5% of multilateral climate funds dispersed for climate change adaptation have been allocated to health projects. Now, when we're talking about policies, what do you think needs to be urgently done at an international level? Now, climate change is a global phenomenon, it's a global issue, and yet certain parts of the world are experiencing a heavy amount of the burden of it. What do you think needs to be done in terms of capacity building?
I think you're absolutely right to point to the fact that the Western world has not really transferred the resources it had pledged it was going to do for adaptation to the developing world, and that needs to happen. It's really shocking that so little has actually moved, and we need to, I think, increase the pressure on governments to do precisely that, because, of course, your previous speaker was talking about mitigation. So, yes, you can move towards more renewables and so on. That's going to take a bit of time. The impact already of climate change is being felt and will be felt in the next few decades anyway, whatever we are able to do with technology in terms of trying to reverse it, stop it. So adaptation is the name of the game. And that, of course, includes also adapting to different health requirements that there may need to be in particular countries that are likely to be affected, are already being affected more than others. So this transfer of funds absolutely needs to happen, but it also, of course, needs to go in the right way. And yes, you could do all sorts of interesting things in terms of reorganizing the way in which you provide your healthcare. And indeed, you can use your smartphones now much more efficiently to get information on what you need to do or where your next clinic may be, where you can have immunizations. But I'm afraid money still needs to move, and needs to move in a big way. And I think the Western world has just not done enough in that area.
Right. And what do you think push that is needed to translate all of what we're saying and make a political push for the Western world in this? What do you think needs more to be done?
There are all sorts of fora. The G20, I think, can become quite a strong voice for this. And if you like, push for that to happen in an accelerated way. I think we have forgotten how little has actually happened in this area. And I think the reports of the sorts that you referred to just a few minutes ago have to really get onto center stage, and they need to be used to remind the various nations at every UN meeting what hasn't actually happened in that area. But of course, there are now quite a lot of firms, including pharmaceutical firms and others, that are involved in ensuring that they look at the aspect of their businesses which is much more looking at what it means for the community, for the environment, and so on. And they have pledged to do a lot more in this area that can also be very instrumental in encouraging not just their own and other firms' behavior, but also how to work in partnership with governments to achieve it.
Right. Ms. Vicky Pryce, now there are research and reports that state that investing in healthcare, of course, yields benefits in terms of development and progress. Could you shed more light onto that? Do you feel like investing in healthcare and making it more accessible can also help access untapped potential of the market?
Well, having healthier people helps hugely, as we know. And if you are subjected to quite a lot of sort of unhealthy environments as you're growing up, you're likely to achieve an awful lot less. So the potential of an economy is affected quite negatively. So health and educational achievements are very closely correlated. And we do those types of tests in the UK and elsewhere, and you can see how important it is for a child to grow up in a particular environment which is healthy and allows you to grow properly. And of course, the more unhealthy you are, the more of a drain on resources you are in the future, and the more help you need. So that, of course, requires a lot more attention in terms of where to allocate resources by the government, instead of perhaps using them to encourage growth. So the links are very, very strong between a healthy society and economic development.
Right. On that point, thank you so much, Ms. Vicky Pryce, for joining us from London. Now we're joined by Dr. Karlson Hargroves from Australia, who's a senior research fellow at Curtin University at the Sustainability Policy Institute. Thank you so much for joining us, Dr. Hargroves. Now, we've been talking about the potential of technology in all of this when we're talking about how to improve healthcare and make it more accessible for people who don't have reach to it. What potential do you see in technology at this point in time?
That's a really great question, and I'd like to come at it from possibly a different angle to some of your other guests. The work that we do, particularly with the United Nations in the Asian region, is to help transport agencies understand how to better use technology. We see that a significant proportion of air pollution in Asia, sometimes 80% of the air pollution in cities, is caused by fuel from automobiles and trucks and buses. And this causes an enormous cost to countries. It's globally estimated at about $5 trillion worth of cost, purely because of the choice of energy that we use in our cars and vehicles. So the sort of technology that we're looking at are ways to not only reduce the consumption of fuel, so electric bikes, electric cars, electric buses, electric trains, but also to how to make shared transit, things like metros and bus systems, work much more efficiently.
Right. Now, in all of this, also talking about healthcare and the specific segment of trying to go out and meet a doctor, remote areas that don't have that facility, and especially when we're talking about developing nations. Is there potential for technology to transform that dynamic?
So the work that we do is mostly in cities, but we also have a massive impact of rural communities that don't have access to any form of link to their major services. So things like rural railway lines, the quality of roads, the quality of transport systems, which makes it really difficult for them to reach any form of health service. Right.
Now, Dr. Hargroves, the report that I've been citing here is by the World Health Organization that states that you need to double healthcare by 2030, or else 5 billion people will be without access to a good quality healthcare. In this, do you think this is a realistic target? This is something that I asked at the start of the show, but I do want your take on it. In terms of sustainable development, do you think this is possible to do?
So from our point of view, it's not so much about treatment, but it's actually more about avoiding and reducing the health impacts in the first place. We see a focus on cleaner, more effective transport and energy use in transport as a way to significantly reduce health concerns. I mean, we're looking at all sorts of things like respiratory illnesses, fear of increased rates of heart attack, pulmonary conditions that are causing a significant amount of this health-related issues, and we're looking at more than 90% of people who live in developing countries being experienced to higher than the World Health Organization's recommended levels for particulate matter. And the studies show that in Pakistan, 100% of people that live in Pakistan are exposed to higher levels that are deemed safe and appropriate by the World Health Organization. So I think we obviously need to improve basic health services, but we will also need to reduce the things that are causing it. And particularly with transport and fuels, there's a double benefit. You're reducing the health impacts and the health-related costs, but also reducing greenhouse gas emissions.
Right. Now, of course, you've been talking about how transportation contributes to a large amount of the air pollution, but we also know that emissions caused by some of the major players, global players, is what's also causing air to be polluted in the most developing nations. In all of this, how do you think countries at an international level need to come to the same table and take certain measures in order to try to tackle the crisis that we're seeing unfold in front of our eyes right now?
Yeah, you're absolutely right. I mean, more than 80% of the air pollution that you experience in cities is from transport. I've just actually come back yesterday from Vietnam, where the United Nations Centre for Regional Development brought together 25 countries from the Asian region to look at environmentally sustainable transport and being able to not only transition fuels, but also be able to provide better services. So a lot of cost in cities is related to poor transport services and congestion, lost time, injuries, as well as the airborne particulates that are causing enormous amounts of problems. I mean, in 5 years ago in the city of Delhi, you could expect someone to die every 56 minutes as a result of airborne particulates, purely from the choice of fuel that we use in our vehicles, and particularly choices that are very much avoidable. The technology we have in electric transportation, in shared, or sometimes we call it public, but I prefer to call it shared transportation, means that we very quickly need to implement these technologies.
Right, and you're talking about the need to implement these technologies at an urgent basis. Now, what do you think needs to be done at a local level to actually translate what we're saying, translate the data into practice? What do you think is lacking at this point in time when you observe Asian countries specifically? What measures are lacking?
That's a brilliant question. I think there's two sides to it. There's firstly the basic investment in the basic infrastructure, so measurement of where the emissions are, where the hotspots are, and helping the industry to transition to cleaner fuels. I mean, there are things that can be done now. The result in Delhi, when they realised every 56 minutes someone was dying as a result of air pollution, was that they mandated a fuel switch in public vehicles and transportation vehicles. So what we're seeing is, obviously, we need to invest in some better testing equipment, but the real key is to bring in the private sector and create a symbiosis between transport and land development. If you're expecting your transportation system to be transformed purely because of the impact it's doing, it's quite a naive situation. Whereas if you can link it to improved value for land, improved investment opportunities, you're starting to improve development opportunities. You have a chance of bringing in the integration of transport. We call it a transit activation.
Right. On that point, thank you so much, Dr. Karlson Hargroves, for joining us from Australia. That's the end of our show today, but thank you so much for watching. We'll see you again tomorrow with more stories. Till then, goodbye and take care.